Treatments of hydrocephalus depends on the type of hydrocephalus that we're dealing with, meaning that if this is an obstructive hydrocephalus, typically relieving the obstruction, if you can, whether it is a brain tumor or even blood products, can relieve the hydrocephalus and allow the spinal fluid to flow in the natural passageways. If it's a situation where the obstruction has become more of a chronic process, then the patient might need spinal fluid diversion. And spinal fluid diversion comes in a bunch of different types. And the mainstay typically is a ventriculoperitoneal shunt, where we're shunting fluid away from the brain and putting it into the abdomen to allow the peritoneal cavity to reabsorb the fluid naturally. And more recently, at least at Vassar Brothers Medical Center, we've started to do another procedure termed an endoscopic third ventriculostomy. Endoscopic third ventriculostomy involves putting a camera deep into the brain and creating a secondary passageway for the cerebral spinal fluid to flow so that we can avoid placing a ventriculoperitoneal shunt in the patient. But the advantage of using an endoscopic third ventriculostomy in trying to avoid shunt placement is all the complications that can come with a ventriculoperitoneal shunt. Those complications include an infection. It can include infection along with shunt malfunction, meaning if the shunt becomes clogged with infectious material or even inflammatory tissue, the shunt may have to be changed periodically, which then necessitates more surgery. Hydrocephalus is one disease in neurosurgery where I believe, the biggest advancements in terms of preserving life has occurred. Meaning prior to CSF diversion, patients would develop hydrocephalus and they would develop progressive lethargy or tiredness and may even pass away. But now with CSF diversion techniques, including ventriculoperitoneal shunt as well as endoscopic third ventriculostomies, people can lead a relatively normal life.